Hi, welcome to Fertility Talks. I'm your host, Mary Wong, and this is live post number 116. Tonight, we are going to talk about fertility preservation from egg freezing to embryo banking and knowing your options. And so I'm really pleased and very excited to have Dr. Julie Lam with us here this evening. And she's a reproductive endocrinologist and infertility specialist from the Pacific Northwest Fertility in Seattle. And before we go into the meat of this, for some of you who are new to my fertility talks, I'll just let you know a little bit about me. And then, of course, I'll introduce our guest. So I'm a traditional Chinese medicine practitioner and acupuncturist in Toronto. I'm the founder of Alive Holistic Health Clinic, and I'm the author of the book Pathways to Pregnancy. And, why do I do this? I do this every week. And basically what I find is, like, when I see my patients, oftentimes they'll get into the swirl of depression because I find them Googling themselves to death and they spiral downward looking at all this misinformation. So one of my goals to bring to you is like good, hard, solid facts from professionals with most current up-to-date research, all of that. Okay, so professional standpoints. And so that's why I'm going to introduce to you Dr. Julie Lam. So again, welcome.
Thank you.
Dr. Lam was a Fulbright scholar in Zimbabwe and then completed her residency in OBGYN at the UW in Seattle and did her fellowship in REI, meaning Reproductive Endocrinology and Infertility, and at UCSF. As clinical faculty at the UW, she directs the REI training of OBGYN resident physicians and is the director of the Center of Fertility Preservation at Pacific Northwest Fertility. Dr. Lam is committed to combining state-of-the-art technology and exceptional patient care to help patients meet their family-building goals. So that's a mouthful. And I might want to add, I saw her in action because before we started recording, was it your nurse?
Yes, it was one of my nurses came in.
One of your nurses came in and, bang, 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 she's offering her advice, and really lovely to see you in action. So thank you and welcome for taking the time out of your busy day or the end of your day to be here with us.
My pleasure. Thanks for having me, Mary.
Absolutely. So I guess with we just want to get straight into it. So why is it important to consider fertility preservation when you're trying to get pregnant?
I think that a lot of times when we think of fertility preservation, we think of talking about it with our patients or our friends or colleagues who aren't currently trying to conceive. But I think that it's a conversation that needs to happen with our patients that are trying to conceive, mainly because, if it's hard to get pregnant now, it doesn't get easier with increasing age. So having the conversation early about what your family building goals are so that we understand those goals and we can talk about them together. Like, how are we going to meet those goals? What are we going to do to help you build your family so that you have some?
Oh, you just cut out for a second.
Am I back?
Okay, you're back.
Oh, good.
Okay.
What happened?
I don't know what happened, but you're back.
Good.
Okay, so, and is there an age group involved that you're dealing with?
I think that the average age of patients that I see has changed a lot in the last 10 years. It went from being, maybe 35, 36 when I moved to Seattle from San Francisco about 10 years ago now. And now it's 37, 38, and it's creeping higher. So if you're already having difficulty trying to conceive and you're 38, it doesn't get easier. By the time you're pregnant for 9 months and you breastfeed that very desired baby for a year, all of a sudden we're 2 years down the road and you're starting that that journey again, trying to conceive. So talking about it with your fertility provider and planning for it early, I think, is a really important part of the conversation.
So I'm just going to jump ahead and think about, those people that have the goals of having more than one child, right? Is that big population that you would
exactly what I'm talking about? Yep.
Mm-hmm. So, and dealing with that currently often?
Yes. Yeah. So if someone comes to me at 38 and they just got married and they've been trying to conceive for a year, and I ask them what their family building goal is, very few women say, well, I just want one baby. Everyone says, well, I'd like to have two, or, I've always dreamed about having three. And so I think it's a really important conversation to have early, because if you're going to embark on some kind of fertility treatment, it might, one, change what type of fertility treatment you start with, and two, change the number of cycles that you do or the number of embryos that you save before implanting them to try to conceive.
Right, absolutely. Because of course, if you're going for an embryo transfer and thinking down the line, you might have another child, and here you are now over 40 or something, right? Then it's like maybe bank more. Yeah.
Right. It's a little crazy to think of, especially because, over 40, we all feel young and look young and we're really healthy. It just doesn't equal good fertility. So, educating my patients about that and learning about how it changes over that really important age demographic is a really important part of the discussion.
And so I just want to do a little add-in, because of course I'm in the world of more natural fertility. So I'm not here to depress people and say, oh my gosh, this is the only option, right? So it is an option.
Right.
And, there are fertility preservation. And I would even say, like, if you are going this route, then you can add in things like acupuncture and herbal medicine to actually, in fact, help. And what I've witnessed myself is like helping the egg retrievals for better quality eggs.
Right. And help patients tolerate the process. In Seattle, we all are very in tune to the very integrated approach that is very helpful for patients.
Yes, absolutely. And of course, you bring in the most important point, because, one of the things that we know through research is that the dropout rate can be high due to stress.
Right.
And we know acupuncture for sure, and other methodologies, integrative, holistic types of health practitioners, they can help reduce the dropout rate, because, you were managing the stress and helping people stay more stable in a very high stress type of methodology.
Right, exactly. This isn't the way that anyone planned on conceiving their family. So taking a hard look on what they can do to improve their chances and improve their emotional and physical well-being during the process is a really helpful piece of the puzzle.
Yeah. So I want to ask you a question, because in fact, someone posted this and I thought, oh, great. Yeah, this is a good question. So the concern was like, what do? Do you freeze the embryo and then you thaw it out and then you freeze it again?
Yes. Isn't it crazy that we can do that now? It's just amazing how the vitrification technology, which is that fast freezing technology, has helped us be able not only to freeze embryos, but also to freeze eggs. So certainly if you're not ready to have your family or you don't have a partner, those patients think about freezing their eggs. And it's that same technology that lets us freeze those embryos after the chromosomal screening and thaw them and have that same success rate, now as they would in 5 years or 10 years from now.
Right. Yeah. Because the freezing process is that good.
Right. The freezing process. Yeah. It doesn't hurt the embryos anymore. So it's really, really great. It's really revolutionized the whole field of reproductive endocrinology.
Absolutely. And it is astounding to me, because of course, all we think about is our refrigerator freezer, and, it gets freezer burn.
Right. I often tell patients that, they don't get freezer burn. They're fine. Yes. They don't have an expiration date. Certainly, you don't want to wait to use them over 50, but thinking about using them when you're feeling ready just takes a lot of stress off planning for that second or third child.
Yes.
Later on.
Yeah. Right. No, I really get that. And I think that really makes sense for that purpose. The one thing I do want to address, though, and because I've actually witnessed this. So I had a lady, so I didn't see her at this point, but when she was living in New York, and, it's like high pace, high stress work environment. And so she decided, her and her husband said, okay, oh, no. She was single at this point because she was working so hard. And she was 37 and she froze her eggs. And, luckily for her, she actually did freeze a lot. I think she might have been more of a PCOS, polycystic ovaries type. So she actually had a lot of eggs to freeze, like 19.
Wow.
Yeah. But when she finally met her husband and they decided to create embryos with them, she ended up like 0 pregnancies from all of that. So it was very disturbing for her. And by the time she felt ready, she was already, I think she was like close to 44, 45. So I think the warning personally is, egg freezing is great, but just don't let it delay you indefinitely.
Right. Right. Yeah, that's a really important message because it's certainly not a guarantee. And, I hear it a lot, compared to insurance policy, and it's really not an insurance policy. If you're in a motor vehicle accident, you get paid and you get reimbursed, and eggs don't work like that. You need a crystal ball because you don't know if they're going to work or not. So we certainly have patients err on saving more than they think they're going to need. And what goes into that equation is partly how many kids they think they want someday and how long they're going to wait to have a baby. If they're going to try in the next year or so at 37, then I'm not as worried about them being able to do IVF again at that age if they aren't able to conceive with the eggs they had previously frozen. But somebody who's going to wait till after 40, when it's no longer as renewable of a resource, it's really important for them to understand that that they might need to look at other options if their eggs aren't working. If their eggs that they saved at 37 aren't successful.
Right. Yeah. Thank you for adding that in. Now, I'm just remembering the second piece of that, the freeze, thaw, freeze thing. I think the person meant to ask about PGS testing, so chromosomal testing.
Yes.
So let you address that in terms of how it actually physically works when you pull out the biopsy.
Yes. So chromosomal testing in the embryos allows us to tell the genetic makeup of the embryo. The embryo can look perfect under the microscope, yet not make a baby. And the number one reason for that is usually a chromosomal abnormality of the embryo that can't be seen with the naked eye, that needs to be seen of the genetics of the embryo. So as the embryo develops, it goes from 1 to 2 cells when it's fertilized to about 200 cells on the 5th day. And the outer part of the embryo becomes the placenta, and the inner part of the embryo becomes the baby. So the genetic testing requires that we take a few of the cells that become the placenta and we test them for chromosomes. And that's like a chromosome count. And that helps us find the one that's most likely to make a baby. And that's what changes with age. The uterus doesn't age, but the quality and the genetic makeup of the eggs and the embryos that the eggs make with increasing age is what changes and causes more difficulty in getting pregnant with increasing age.
So what I want to add in is that I think there's this misconception that somehow the embryo may suffer. And what I want to make clear is that you take the biopsy and then you freeze the embryo, so the embryo is actually safe and they stay still. Versus taking it all about and then biopsying and then refreezing or all that stuff, right? So it's not frozen and then thawed and then biopsy
and then refrozen. Yeah, as it grows and divides, and oftentimes clinics will assistedly hatch the zona, which is the shell around the eggs. So oftentimes the cells that are biopsied are already starting to push out. So as far as we know, it doesn't hurt the embryo, but there's no way to know for sure if it ultimately impacts implantation rates a little bit. It's possible. We don't think it hurts the embryo. We see very healthy children and very healthy pregnancies, but no one can tell you 100% that it's okay.
Thank you for saying that, because, we do. I mean, this is a reality. It's not 100%.
Right. It's not.
Yeah.
I often tell patients it's the best test we have to help you get pregnant and to help you find the embryo that's going to make a baby. But once you're pregnant, we're testing a few of the cells of the embryo. We're not testing the whole embryo because that would kill it.
Yeah, absolutely.
So all that normal testing that you do in pregnancy, it should align with the testing that happens to the embryo, but it's not that you forego all that testing just because you tested the embryo. You still need to go through that normal age-related risk testing once you're pregnant, because it's testing a lot more cells than we can test of an embryo.
Got it. So meaning that they're still doing the nucleotranslucency test on week 12 and then the 19-week anatomy scan like that, right? So you wouldn't.
Yeah, even like patients that with advancing age will do free fetal DNA or an amniocentesis if it's indicated. And it's really important to note that the nucleotranslucency and those other tests are looking for other problems or other things that aren't always chromosomally related, like neural tube defects and anatomical problems with the baby.
So then let's just add in this, the NIPT, the neonatal screening, that one, the blood test. So does that become redundant when you do a chromosomal test?
I think still a lot of patients will consider it when we're testing. So the free fetal DNA testing that Mary's talking about is circulating fetal DNA that becomes detectable once you're pregnant in the maternal blood, which is crazy. It's changed so much since I had my own children. But yes, you're able to detect that in the maternal blood, and often patients will do both. It's a different way of looking at the same thing, but it's important to confirm. Not any test, no test in medicine is 100%. So getting more information that confirms what you knew before is very reassuring.
So you don't think it's an overkill?
No, I don't think so.
Okay. That one's new to me. I'm like, okay, that's great. I love it. Okay. So then, so you said people that are planning to have more than one child, but then who should freeze eggs?
So lots of different people choose to freeze eggs for a whole variety of reasons. It's so crazy in this field. Every patient is so different. I think from the outside, it seems like every patient has a very similar treatment plan, but that's not the case. So I'll have a recently divorced patient freezing their eggs. I will have a young college student who's moving abroad for a few years freeze their eggs. Somebody who's losing insurance benefit that's not sure they'll need eggs, but they have a benefit now and that's going away. They'll choose to freeze eggs. So people choose it for all different reasons. Somebody who's in a relationship or has even a husband, but isn't sure that they're going to have kids and finds it a little bit easier if they don't choose to conceive someday to discard eggs than they would to discard embryos. So there's a whole variety of reasons that people choose to freeze eggs, and it's very personal and individualized between the patient and the provider.
Absolutely. Yeah, very interesting. So, what are your last words of advice for couples who are down this road and trying to conceive?
Yes, I think just never losing hope and never being afraid to ask questions and just always knowing what your options are. Knowledge is certainly empowering, and feeling like you have all the information really helps make a decision that's right for you and your future family.
Absolutely. Thank you so much for your wisdom, and I hope that you enjoyed this part of the fertility talks. And
I did.
Great. Awesome. Oh yeah, absolutely. And the more voices that we have on this, the better. Like I said, I can't stand it when patients just like on their own Google everything and they think that they know because of other people's experience through these chat rooms. It's like, stop it.
Yes. Yes, I often tell patients, if they're happy and they have a baby, then they don't write about it. And if they're feeling overwhelmed and confused, then that's when they blog about it. And that's not necessarily who you should choose to listen to.
No, but they do, right? Because there's so many blogs about it and so many chat rooms, and they're just complaining.
Yes, well, we all just really want to have a baby.
Absolutely. Well, thank you so much for that. And everyone, thank you for joining in. And next week, and it'll be on a Thursday, we're going to have Dr. Magarelli from Colorado Springs, and we're going to actually be talking about endometrial receptivity. So different kinds of testing, the ERA, the matrix testing, and EFT. So lots of acronyms for you. So we're going to cover that. And by the way, for those of you who are in Toronto or nearby, there's a function, it's called the Canadian Fertility Show, and that is Saturday, February 23rd. It's an all-day event. I'll be one of the speakers amongst a lot of other great fertility specialists. So please come out if you want more information. Obviously, if you don't want to be overwhelmed with lots of information, don't come. But a lot of people want to geek out. So it was amazing last year as the first show, and there was this crazy blizzard snowstorm. There were over 400 people that showed up. So I think it'll be some kind of thing like that, because you know what? Women going through fertility or couples, highly motivated. You'll do anything. So again, thank you so much for joining us. Thank you, Dr. Lam, and we'll have a great night, and we'll see you all next week. Okay, take care. Bye for now.
Bye.